Absolutely. It is really true that I began my work in advocacy truly. I had this idea that we needed a council, and I had never contacted a legislator before. And I truly went up and just told my story about my daughter to my own legislator and why rare diseases mattered and why we needed to prioritize them. So I think it is truly true, especially at the state level, that these legislators care and they want to hear from their constituents. So I think that the starting point is find out who your state representative is, and send them an email, give them a call, set up an appointment with them, and just let them know that rare isn't rare. I think that was the first thing that we really had to work on to help the legislature understand that yes, an individual disease might be rare, but collectively with 10,000, they affect a significant amount of Minnesotans. So telling your story, and then yes, we're currently working through our policy platform for this coming session. So I would love anyone who wants to be interested in helping us go up to the Capitol and talk to legislators. But starting with your own legislator, if you're an advocate, telling your story, if you're a researcher and a clinician, saying why it's important to you, it's very meaningful. I always say too that the legislators hear from professional, government relations people every day, all day, and that's wonderful. That's what they do for a job, but they really love to hear from actual people that don't do it for a living and are really coming with their story.
Is there somewhere that people could go to get more information on those bills that you have drafted?
Yes, so we will. So the ones that I showed that are on our website right now are what we've worked on in the past. When we get closer to legislative session, we will put up what we're working on, and so yeah, that information will be up. We're actually also working on getting a form on our website where people can say what if you have a rare disease or if you're a researcher, what barriers you're facing, so that we sort of have a handle on what we should be working on.